Hello and welcome to the Confluence Festival Thought Series. My name is Mark Bereavy. I'm Director of Community and Government Relations here at Michigan State University College of Human Medicine. I have the honor of welcoming you to the MSU Secchia Center. The Secchia Center, as probably most of you know, opened in 2010, and it marked the expansion of the MSU College of Human Medicine here in Grand Rapids. This building and expansion would not be possible without the support of this community, and that is why we are so honored to host the Confluence Festival Thought Series. With that, I'll turn things over to Birgit.
Thank you very much, and welcome everybody. It's great. I'm ready to go. Honored to be moderating this panel of what I call rock stars. Three incredible individuals that I've had the privilege to work with over a number of years, one just most recently, who bring their talents, and truly their immense talents, to our community to really change Grand Rapids for the better, and not just Grand Rapids, but really in many ways things in this country. So I'm very honored to have that, and I want to thank Brian and the organizers for asking me to do this. Again, really a pleasure to be with friends in the audience. And I have to say, when Mark said it's been 12 years since it's opened, it's been 15 years since when I sit here, this was a parking lot. This was a parking lot for the Michigan Department of Transportation, and the Annual Institute Phase 1 was across the street, and a whole lot of what is here now wasn't here at all. And it's amazing to me what 25 years can do, and it'd be amazing what else can happen. So what we want to do this evening is really moderate a Q&A with these three wonderful folks, and then leave time for you to ask them questions, and have a conversation about what we are really doing up here and what they're doing individually. So what I thought we would do is have each one of their bios you can look them up, they're long. But I thought if I'd ask each one of them to briefly introduce themselves and what they would like to get out of this evening and what they hope you get out of this evening. So Dr. Norm Beauchamp, the Executive Vice President of Michigan State.
Yeah, thank you. And thank you everybody for being here. My background, I'm an interventional neuroradiologist, 2 times Spartan, grew up not far from here. And my goal was to try to lessen the impact of the disease. And I worked on stroke. That was my focus. And as I thought about how to scale what I had been able to do working with a small group of people when I was at Johns Hopkins, it brought me back to West Michigan because I saw that it was a place that could be very intentional in trying to do something that mattered. And the ability to bring a community together was what was very striking to me. So I came back in 2016, compelled in large part to work with my partner, Birgit, who is super inspirational. And now my role is as Executive Vice President. So I oversee the 2 medical schools, the nursing school, public health, Michigan State Practice Plan. And ultimately, the goal is how do we work together to lessen the struggles of people. So when we think about innovation, right, it's really about too many people struggle, and we have to find better ways. And in working together, we can do that.
That's awesome. Privileged to be here. Thank you all so much. Ollie, Howie. I'm Managing Director of the New Community Transformation Fund, and we're a venture capital fund based here in West Michigan, looking to invest in the best companies that are founded by folks of color, and really excited to get up and running and invest in BAMF Health as our first investment, and really excited about the mission that we have, investing in world-changing companies and also changing the narrative around capital. And so I hope you all can take away a new perspective of how we're looking to continue to innovate here on this medical model, and hopefully I'm taking away some community and giving some community as well as we look to wrap community around our entrepreneurs.
And I'm proud to be the board chair of the new community transformation.
Proud to have her.
Andrew?
My name is Anthony Chen. I am a certified nerd, so I got a PhD in medical physics and being a scientist before I started my entrepreneur journey. So my lifetime mission hasn't changed. It's actually basically bring the best technology to the patients as soon as possible, make all this kind of technology affordable and accessible to the patients. And then myself actually is expertise in a new technology called molecular imaging and molecular targeted radiation therapy. I know this is going to save a lot of life, but unfortunately we don't have these kind of infrastructures in a nation around the world to actually make it available to the patients. So this is a very, very hard task, but these are things that need to be done. So in 2016, we decided to actually focus on start the BAMF Health to focus on these missions. So BAMF Health is never trying to start to become a company. BAMF Health is using a company format to conquer this mission, making this technology available and affordable to every people who need it. I'm very fortunate to brought up to this community in 2010. Before I was brought out to Grand Rapids. I have never heard about this town. I don't know where it is. And I was brought here in February. But I still feel extremely amazed like how strong the community support is and the beautiful, beautiful, impactful vision about the medical mind to shorten distance from the bench side to the bedside to impact the patients. 12 years later, I still believe this is the place to make things happen. This is literally the place allow world-class things to happen, and we're here to prove to the world this can be done.
Well, you touched on it a little bit, but you three are not from here, for that matter, neither am I. So I'm curious, and I'm sure the audience is curious, why here? You're a Michigander, you went to Michigan State twice. I think you had a residency, Norm, across the street, right? And left, and then returned. Why? Why you had the world open to you? So why this community? Why did you come back? What intrigued you about it?
Yeah, thank you. Great question. So when we think about the efforts to bring health, hope, and healing to people everywhere, and health disparities and how they persist, and that when we look at technology development in many sectors, it's seen as the solution, but in healthcare, it's often seen as the driver of cost. What I was looking for was a place where an ecosystem could be created where you would have world-class clinical care, where you'd have world-class education, where you had health research, and then a place where you could then recruit industry partners to innovate in a way that went directly at the challenges that people faced. And when I looked at, I left here in 1991, and I just started reading about the community and grand action and how the community set a goal. They went directly at it, and you come to this community and go, wow, they set huge goals and they execute. Because to be successful in this, groups from very different sectors have to come together, and the community has to believe in setting a goal and being intentional and working together. So I was actually a finalist in looking at another role similar to this role when this came up. I flew into Grand Rapids and I'm like, nope, this is the place. And so I think it was just the realization that you can set big goals here and you can collaborate here and you can accomplish them. That's what brought me here.
So Anthony, you touched on it a little bit. You came here in February. You could be anywhere in the world.
Yeah.
I think you started at VAI, right?
Yes.
So why here? Why not start BAMF in New York or in Cambridge or in San Francisco? Why here?
Yeah, that's a very good question. I got being asked this question all the time. So at that time, actually, when I at that time, I actually have a several job offer because it holds very unique technologies. And then I can be in development technology, development department, become another like a professor, follow the conventional like a tenure track, academic track. Or I was thinking I should start what's a real impact I can make. Publishing, I never believe publishing paper and publishing paper only is the duty of a scientist. I really think a scientist should develop technology, really be able and bring it to the society, really impact lives. So at that time, I was brought like introduced to Vandal Institute over here, and also introduced to the medical mile concept over here. And I know there's this kind of technology over here. We don't even have a foundation work over here. But I believe if I'm willing to come over here to bring this technology over here to the community, not only to West Michigan, but to Michigan and Midwest, then that's the impact that I want to make. I know this is going to be extremely, extremely hard, but I think that will be worth my effort. And on top of that, the concept, again, how to translate the technology from bench side to the patients as soon as possible, that concept really, really attract me over here. So that's on top of coming here in February to experience the weather, and also identify there's no taco in 2010 at that time in Grand Rapids, and order these good tacos, authentic tacos, and I still decide to come over here. It's literally the great visions, the community set up for generations and executed. Yeah. And I do believe the power of Grand Rapids. I mean, with this kind of infrastructure, we can really achieve world-class things. I believe the real power for this community have not been fully released that yet. And so that's why I decided to start BAMF Health from Grand Rapids. And the goal is not only to make a successful case for the industry partners successful in medical mile, but also use this case, allow the world to see Grand Rapids and also bring the Grand Rapids to the world.
Yeah, and if Ollie will indulge me, I would just add that a few things is one, I promised my mom I would come back to help run the state. It did so much for me. I got a scholarship that helped me pay for medical school, and I promised the dean one day I would come back. And you gotta keep first promise to your mom, and then certainly to the college. And then third was one of the unique things about Michigan State is it's a community-based medical school. So what that means is it partners with communities across the state. We also have Ag Extension, which is 4-H, so they're in every county. And sometimes with academic universities, a big part of the strategy is how do you bring people to the coronary care center, right? But what people really want is care closer to home, so that when you're ill, you're by those that love you and can support you. And key to innovating in a way that heals is to not only discover, but to implement, and then see is it working, is it helping, and repeat. And it was the feeling that with the hub that we could create here, while having these connections to counties across the state, you could actually learn what people need, put it in place, measure it, and repeat. So it creates a pretty incredible innovation ecosystem where partners that come into that can then have the proof points for what is created, which then helps them, right, open up markets, which then ultimately go to social determinants of health and job creation and solutions. And so it was that kind of flywheel put in a place where things can happen that really make it. And my commitment to my mom. Thank you, Ollie, for indulging.
Ollie, you were the latest addition to the community. You joined us back in November. So he came in November. We're pretty close to the same time, right? So, and he's from Virginia, and he came here via Atlanta. Again, talented person. What intrigued you about the opportunity, and obviously the community as well?
Yeah. I mean, Grand Rapids is really innovative. Birgit, as you know, this is the first venture fund that we have of its kind in the nation, focused on folks of color, and then also a specific region. And just seeing the positive externalities or benefits of actually investing capital in companies that can grow and scale, hire folks that are native to Michigan, be able to reinvest in Michigan, while also creating something that's generational and that can hopefully live beyond us. Some of this technology, like Anthony or Dr. Chang was alluding to, will be groundbreaking and here for hopefully future generations to take part of. And so we'll create this template in Grand Rapids, and then we already have Denver online to be New Community Transformation Fund Denver, and hopefully we just create a new narrative around capital. It's not that many funds investing in folks of color, period, in venture capital, and we think that can really change outcomes for people when you think about the jobs that can get created and the wealth that can get created for a number of generations. So we're excited that West Michigan was the first, and spearheaded by you and all of the great, generous limited partners that have come into the fund and that see this as a real opportunity to make great returns in terms of wealth, but also in terms of just community and what we can give back to the community.
So the New Community Transformation Fund is a new venture capital fund in the area, and I see some folks who are in our investment committee. Good to see you. It was an idea that came after some frustration of what can we do as economic developers in terms of changing the trajectory of ownership of companies owned by entrepreneurs of color, and through partnerships and we raised about $10 million and hired Ollie, and just so you kind of get the context, and the first investment went to BAMF, so that's a little bit of background. So there is what I've heard you say. Somebody mentioned the word ecosystem. Somebody mentioned the word innovation. Somebody mentioned infrastructure. So what we have created, or what we are creating, is an ecosystem, right? So how important, and I'll just throw this open, and just between the three of you, how important is an ecosystem? What are we working toward in that ecosystem, and how does it work? And more importantly, why does it work? Who wants to go?
I think an ecosystem is very important, and the most important part is not exactly what this ecosystem is. It's what's the culture and mindset we create in this kind of ecosystem. Because I deeply believe is the people make things happen, not the things make things happen. Then how people make things happen is a group of people with the same mindset create a certain type of culture, and then we can conquer a lot of things. And that's exactly what I experienced over here. The medical mile concept over here, and a lot of renovation things over here for the past 20 years. It's extremely bold. I live in so many cities around the globe, around the United States too. I mean, for this size of city, the things we achieved for the past 20 years is amazing. Especially, it's not like a lead led by the government. It's actually led by the community. This is almost like a miracle. But with this kind of big vision, and with make a bold decision, and also determined to make things happen, and one after the other, this is a great achievement we have over here. And then when I start BAMF Health, I mean, everybody think this is a crazy idea. This is impossible. And so, I mean, I say I'm going to put a cyclotron in downtown Grand Rapids, and not only one but two. And we're going to bring the most advanced things, scanners in downtown, the most advanced clinic in downtown, and it's going to be the world's most advanced facility in downtown Grand Rapids. People totally think it's impossible. There are so many reasons says these things cannot be done. But I always feel like people totally confused about two things. Things are very hard, and things are impossible. I mean, as long as things are not impossible, and there's definitely a way to make things happen, and our job is not trying to find 100 reasons why things cannot be done. Our job is only find that one way can make things happen. And then that's exactly what happened in Grand Rapids. And the reason it happened is not just because of me or BAMF team, is we have a group of community which share the same similar mindset. And I want to share a story, like why I believe these things can happen. I think it's in 2016. It's the first time I met with Birgit, and Birgit had this story. She didn't, a lot of people said, oh, this is a crazy idea, and just smiled. So yeah, this can be done. And you need to talk to Dr. Beauchamp. I said, okay, I don't know Dr. Beauchamp. So on Saturday night, like at 12:40, they said like 11:59 or 57 p.m. And I got an email for Birgit, introduced me to Dr. Beauchamp. And at 12:53 a.m., I got an email from Dr. Beauchamp, nice to meet you, let's talk. And I replied at 1:29 a.m. and do that. And because of these things, I know these things can happen. It's because we have a group of people never think about why these things can be done, but focus why these need to be done and how can we make these things happen with an open-minded, with bold mindset, and then explore things. And 5 years later, 6 years later, that's what we have over here. And I want to share with the team over here, next week, we're going to host the GE National Cyclotron Engineer Training in Grand Rapids, in MSU BAMF, like a radiopharmacy facility. 2 years ago, 5 years ago, can you imagine this? Will you believe this is going to happen? But this is literally happening. We're literally the world's most advanced radiopharmacy in the whole world. And that's why the whole, we're going to see this kind of event more and more often. The world-class expert patients and the doctors are coming here to train, coming here for treatment. And this is not because BAMF helps. It's because the community we have and we share this kind of bold mindset to make things happen. And this is actually how I see what kind of ecosystem we need to build and why it is so important is the mindset.
And why does it work?
It's because we have this kind of mindset and we are all synced with each other. Based on physics, when all the vectors align with each other, we have the most powerful force, and we can break every single barriers, make things happen.
Well, I have a question. Does everybody know what BAMF is and what they do?
Yes.
No. So do you want to just quickly,
Yeah.
Now, when he explained this to me once, I speak English, but I don't speak scientist. But anyway, it's fascinating. So if you could just give a sliver of what it is.
Yeah. So BAMF Health, we're a technology company focused on bringing a technology called molecular imaging and molecular targeted radiation therapy to the patients. In a very high level, we created radioactive drugs, can do diagnosis and therapy. And these radioactive drugs act like a drone and designed to looking for a specific disease. Take prostate cancer, for example. We have a prostate cancer drones to go inject into patient's body, circulate it over body, finding where the prostate cancers are, bind to it, send out signals. So when we put these patients under a PET scanner, PET, positron emission tomography, we will know exactly where the tumors are, how many are there, and what kind of treatment we need to treat these patients. And if you have a multiple, we call it metastasis or spread out cancer over the body, currently the only solution is through chemo or hormone therapy. But we can actually make it a drone loading therapeutic isotope, go after every single tumors we see, bind to it and burn those tumors out without hurting surrounding tissues. The reason it will hurt surrounding tissue is those isotopes will release all the radiation energy within 2 millimeter range. So it'll burn everything out, but within 2 millimeters, but left everything unharmed, outside of that. So using this kind of treatment, not only we have already brought a lot of end stage, currently considered untreatable cancer patients back to complete remission, and we also significantly improve their life quality. And another very exciting news is, we are the first group in the world that go do clinical trial in Germany 6 years ago. And after the whole world collaboration with a lot of academic center, hospital system, this treatment is literally get approved 3 weeks ago. So this clinic in downtown Grand Rapids is the world's most advanced clinic and also the only clinic allowed us to do the high volume of patient treatment. So that's why we see not only we're going to see a lot of national, international patients come to Grand Rapids receive this kind of treatment, but the doctor's gonna come here to train, working with MSU on potential fellowship and the training program for next generation of doctors, but also engineer, pharmacists, the scientists will leverage this facility. We will lead the world on this kind of a technology.
So it's pretty amazing if you think about it, right here in West Michigan. 25 years ago, the Institute was announced, about 26 years ago. It's been in business since May 2000, so it started all with the Van Andel Institute, and what was up on this hill, for those of us who remember, was a parking lot and a lot of old buildings, and what has happened in 25 years is pretty amazing. So Norm, you know, the ecosystem that you added to here to Michigan State, I remember when we had the Institute and Spectrum Health across the street, and everybody said you need a medical school, and then of course it has grown, and you always talk about population health and what does that all mean, and so what does this ecosystem mean to the goals that you have?
Yeah, thank you. I remember that exchange very well. And I remember people saying, can this guy really make this work? And I'm like, yeah. And that goes to this, and again, and part of why it takes a community was by virtue of you making the introduction, it was somebody I trusted, right? When you said I should meet this person right away, you start with a default trust, right? And then Anthony reinforced it, and it grew from there. So one is an ecosystem, right, of trust. And when we talk about what we built, you know, for example, an innovation cycle was an example that might be helpful was I was treating a patient in the emergency room, and I couldn't help them because they got to the hospital too long after their stroke. And it was haunting to me that I couldn't help these people who came to me for help. So I then started looking about was there existing knowledge that wasn't brought to bear in the clinic. It takes about 15 years to go from what needs to be done, what we know will work, to its implementation. But as I looked, there wasn't existing knowledge. What it was a fundamental lack of the manner in which you image the brain. And with CT, you measure density. That doesn't change fast enough for you to be able to see stroke. So that then caused me to wander the halls of, I was at Hopkins at the time, and find people like Anthony. I found some physicists and some physiologists who found a way to measure the speed at which a water molecule moves every 50 microseconds. And what they said was, well, we know how to do it. We don't know what to do with it. I said, well, I've got an idea. In stroke, right? Water molecules get trapped in the cell, they can't move as fast. If we can use this to develop a new way to image the brain, we can extend the treatment window of patients from 3 hours to 6 hours. If you can do that, it's about 4 times as many patients. So we developed this, a few other institutions, and fast forward, we then translated it from the research to the education to the clinical, right? It starts to form this arc, which defines the ecosystem, right? Is how that connects. And I was really excited because one day I was on call. I'm a neurointerventionalist, right? I put catheters up to Scott, right? To remove clots. And there was a patient at Georgetown who got to the hospital too late, and they said they couldn't treat her. But her husband had gone to Yale, who knew about the work at Mass General, who knew about our work. And before we knew it, they flew her to Hopkins. We were able to do this imaging. We were able to remove the clot. And she walked out of the hospital. And you say, hooray, that's a great outcome, right? Is we could help somebody who would have not been helpable. But what's the injustice there? Right? The injustice is she got access to care because she knew somebody who knew somebody who knew somebody, right? And that's the big tragedy in healthcare, right? Is that we'll know we're done when you don't feel like you need a navigator to get access to the best care. And so what we then did is we brought in industry partners. And we said, let's work together to productize this because you have a global distribution. So what we create, we can then take other places and address that barrier. And so it was the goal in coming here was to systematically build those pieces, right? We had, the medical mile care delivery, and we had education. We have a statewide education program. We didn't have research, and that was where our partnership with the Van Andel, right? What we wanted to do was to build a research building, but the only way to build a research building, right, was first to work with the community. It's incredibly supportive, right? But then the day you open, you don't want to wait 4 years to get researchers. So the Van Andel said, we'll house your researchers as you recruit them, put them with us, and the day you open, you can be up and running. That goes to partnership and ecosystem, right? And then the final piece was once we had the research, the education, the clinical care, the partnerships, then it was the innovation park. To build an innovation park, we had to find amazing partners like Anthony and BAMF, right? Critical. And then we had to work with Mike Van Gessen and say, will you build us a building on the belief that we can recruit innovators to Grand Rapids, right? And he was like, yeah, I trust that you can do that, right? And then maybe the one of the best examples was then finding partners who could support and believe. And your relationship with Doug Meyer, and we have Mark here. And part of what was important to the Meyer family was this idea that care should be accessible to people everywhere, which is it's your thesis in BAMF, it's our thesis,
Yes.
right? And that was why we came together, and that was why when, you see the building is named the Doug Meyer Medical Innovation Building, because the Meyer family and Doug said, we believe in this and we want to support it. And if they didn't believe in it, the infrastructure necessary to make this incredible building and do the work you're doing and the work we're doing wouldn't have been possible. So that's the other part that happens here, is that there's people who have been successful and have means, if it's for something that matters, will support it. And all of those pieces, the Van Andel didn't have to help us, right? They could have seen us as competitors, but they were focused on the outcome, right? The family coming together, the partnership, right, with BAMF, it's made it possible. Mike Van Gessen's trust, all of that. And then all the catalyzing that you do, right, which was part of our being able to say, yeah, we can recruit innovation companies in this new structure, right, was saying, yeah, the right place knows how to do that, we can help you. And then fast forward, right, one of the big parts is, well, how do you fund it, right, these companies? And then Ollie comes and joins us because of this fund. And so when you talk about an ecosystem, right, it's all those parts, right? And now I believe those pieces are here, right? And I think Parago's a really amazing example of that, right? $5 billion a year home health company. Why did they move on there? Because they're all about solutions closer to home, right? And now they're a part of this ecosystem. Sorry, I'm going on a bit. But then you look at that and you say, well, what's innovation? Well, it's maybe widgets, but it's process innovation, it's product innovation, it's market innovation. And so this ecosystem with many of the great universities here, and then we're bringing like supply chain, right, from Michigan State, because that's a huge part, right, of getting products to people in an affordable way. Communication arts, change in healthcare, they're a part of it. So all of those things then just connect and it continues to scale. So it's a place to be.
Yeah, I totally echo that. I think this project, if you think about, just take this project for example, the whole story is filled with people willing to make a bold decision and taking a risk. At that time, I met with Birgit and Norm. I was one person working East Grand Rapids Library and being kicked out every day at 3 p.m. And then talk about we're gonna build these kind of things in downtown Grand Rapids. And Birgit said, yeah, let's figure out how to do that. And you talk to Norm. Norm said, it sounds fantastic. Let's figure out how to make things happen. And then we started, it's this mindset, how to make things happen instead of why it cannot happen, is making the whole thing happen, right? And then we talk to the local partners to think about how we're going to make this building happen, how to develop that, how to build this. We talked to Rockford. I mean, have you built a cyclotron facility? I have no idea, but I will figure it out. Have you built a molecular imaging and diagnostic clinic? Nobody knows how to do that in the world. We will figure it out. And then it's this we will figure out those mindset, make everything happen. And also with the strong the strong support from the Meyer Foundation, Meyer family to enable this to happen. And then to the end, but in this process, a lot of time talk to the startup community around the nation. People say, why you start from Grand Rapids? This project can be way easy to start from like a New York, Boston, or Silicon Valley. And they say, look at the number. There's only a very small percentage of venture capital in Michigan, like invest in Michigan company. You just don't have those kind of environment. I said, that's exactly why we need to be here. I believe we have those kind of people willing to make things happen. We just haven't identified the gap is. And one of the mission for BAMF over here, not only trying to explore this track nobody has explored before, but another thing is we want to identify the gap. And once we identify the gap, then we can fix the problem and start making the ecosystem way more comprehensive, way stronger. And so last year, the new company fund happened, and we're being extremely honored, like receive their first the investment. And then that's the time I can proudly to talk to the startup community. Yes, we have this in Grand Rapids right now. Look at what we have achieved. So gradually, the community working with each other, this is a group of adventure explorers working with each other and to start advance the unknown and feel very comfortable to explore this unknown in this community, and gradually will be seen very soon by the world.
So Ollie, how important is that whole ecosystem to the fund?
Yeah, no, it's extremely, echo all the sentiments said. It's extremely important. You hear the adage, it takes a village to raise a child. It takes a few communities, a few villages, and some more people to get to a really big company and to create that from nothing. And so it's really tough. And so what we look to do with the fund is not only connect them to other ecosystem partners that are also funds, so syndicated and have other venture funds come in alongside of us, but also open it up more broadly to the community and figure out what exactly we can do to alleviate some of the things that entrepreneurs face that they don't necessarily have to. And if that's recruiting, if that's making sure that their family life is in balance and that we introduce them to great folks when they get here. Anything in between that really does make a difference when you're trying to create something very innovative that nobody has done before. And so, we definitely need an ecosystem. It takes all of you, it takes a community. Ultimately, we create businesses, think of ideas to serve the people of West Michigan, Grand Rapids, of the United States. And so listening to you all and your feedback alerts me as a venture capitalist if something will be really good or not. It's 2 million people each year that get diagnosed with cancer, and we still have really archaic means of treating them, and chemotherapy that kills the good cells and the bad cells. And so introducing something that's as novel as BAMF, for instance, just makes a lot of sense. But the community also has to ultimately embrace that too, for an investment to be successful. And so everything from early stage capital and partnering with folks that provide early stage capital like Start Garden and other folks, and late stage capital as well, making sure that we're not the only check that goes into a business after we invest, to just the soft things that seem soft, but they actually add up from the great things that you do to open up community for folks. So we want to add all of that to our portfolio and hopefully make West Michigan really enticing to get that San Francisco type of effect where if you want to start a company, you come here because it is the ecosystem, because you can hire people, you do have the talent, you do have the community and ecosystem around you. So that's what we're striving to, and we've gone a long way with this medical mile, and thanks to Birgit and a lot of you in the audience.
Just the moderator here, Dennis. So I have a question about talent, and then I know I'm watching the time because I want to open it up. So I remember when the Van Andel Institute was only an idea, and we flew out to Frederick, Maryland, to attract the first batch of PhDs and postdocs, right? So they were like, "You're doing what, and where are you?" And like Anthony says, "Where is Grand Rapids?" Right? I mean, 25 years ago, it was really flyover territory, and we convinced Dr. Vanderwood to come, and he convinced a few folks to come here to really be entrepreneurial, and the institute started. So talk to me about talent, you know, because it drives everything today, right? I mean, the room is full of talent. This is talent. You're amazingly talented. What has changed that makes it easier for you to attract the talent today? I mean, you know, because it certainly, I know that Dave Van Andel always says he has the United Nations working over there. And I know there's folks from, 30-some countries working on the Nile. So talent drives everything. Talk to me about your efforts at the talent. How is it easier to attract it today, and why?
Yeah, I'm glad to start. We had 11,000 applicants for 200 spots in our medical school, right? And part of that is it's a very special place to train, great opportunities, right? So that's a part. I feel like we have a really unfair advantage relative to Stanford or NYU or Harvard. And by this I mean by starting to connect, right, the strengths in this community, and then having facilities that are state-of-the-art, and then through partnership, for example, like with BAMF, we have access to this PET-CT and the PET-MR, so that if you want to do autism research, Alzheimer's research, Parkinson's research, you have access to resources you don't have in other places, or the work we've done with the Van Andel to get the best microscopes because they're shared resources. And so you have that, but then you add to that, you can afford a house here, right? The most expensive house that was listed in Grand Rapids, I think 2 years ago, was less than like a 1-bedroom in Palo Alto, right? So you can raise a family, you can have a home, you have access to education. And I think that creates an unfair advantage, well, a really great advantage. And then the strengths of collaborations, right? In that collaborative spirit, I think is really important. I think a missing piece of bringing people here is some of the work that I think Ollie's contributing to, that I think if you were a person of color, this recruiting people here is difficult. And there's been a lot of effort to make the environment much more welcoming, and I think it's critical. And I think I'll give you an example. Our medical school is about 27% students of color. And we see that as really important, because if you're going to be successful in treating diseases that affect all people, they have to be people that understand the challenges that face those communities. If you look at the disparities in health for men versus women, they used to be really enormous, and they've gotten a lot less as the number of women and men in medical school. Right? So we're going directly at that. But one of our challenges is that our students of color didn't find Grand Rapids to be a place that was welcoming for them. And so I think over the last 3, 4, 5 years, right, we've worked really hard to help show that this is a place. As we saw, right, with the recent tragedy in our community, we have more work to do. And so I think that is the piece that I also appreciate. That is I think a missing piece that we're going directly at, and we have to.
That's one of the reasons the fund was started.
Yep, right, perfect. So I think that's why we have I think we can out-recruit anyone from anywhere, and we've demonstrated that.
Yeah, I think, like I agree with Norm, we really have an unfair advantage over here. Just this gem has not been discovered. I mean, from my entrepreneur mindset, when I start a company, I mean, to be realistic and analyze why I want to start from Grand Rapids compared to Silicon Valley. Yes, Silicon Valley maybe it's easier for us to find a fund, But how am I going to use those kind of funds? Majority of those things are going to rent very expensive, lousy spaces, and all my staffs is going to work in a barn, right? Like very small, like a barn, privy barns to work things. It's not ideal, and their life quality is not ideal over there outside the job, so they cannot like focus on doing the innovation and productive work. In Grand Rapids, not only we have a very reasonable living cost, but we have a great living quality over here, and that's a very reasonable, unfair advantage over here. And on top of that, I think the talent actually, they don't come to the job looking for the pay only or salary only. The talented people, they're looking for a stage, and to really allow them to shine, allow them to release their really like a power of that. And so this community right now, and also in BAMF Health, we're focused on developing that stage to extend the possibility for them to achieve. Now, so not only for our the things that attract our team members to Grand Rapids, not only because we build a world's most advanced facility over here, the things we're going to tackle and problem is hard, is cool, but also they have a lot of extended resource and collaborative opportunity with the outstanding scientists from MSU, maybe with a BAI, and with the Spectrum Health, the hospital system, the pediatric system. They have a mindset project they want to tackle. They think it's meaningful, and the possibility is here. So they are the meaningful and reasonable life quality and living environment, and also set up a great stage, allow them to shine. I think this is a great advantage for Grand Rapids to start attract people. We just need to let people know about it, and people start knowing about it. For BAMF Health right now, we have about 70 team members. It's come from 11 different kind of countries, and so they all gonna start moving to Grand Rapids.
Good, well, that'll add to the diversity, and I'm going to open it up to Q&A. But you touched on a very important subject, Norman, that's being inclusive. Okay, and I learned a saying, and I don't know who said it, but welcoming someone is taking them to the party. Including them is asking them to dance. So if we're bringing folks who don't look like Birgit to the community, then we can't just say, hey, gee, welcome, Anthony, but we also have to ask Anthony to dance, right, or Ollie to dance. So that's how we're going to change literally the complexion and the trajectory of our community. So while we could go on up here. So questions and answers, or questions from the audience, and those are speakers in front of you, so there's a little button at the end if you want to ask a question. That will actually activate the microphone. So,
or guidance, input, direction, anything.
Comments, yes, Dick.
Yep, Ollie, what are some of the basics of the fund? Minimum investments, are they brand new startups, or do they have to be in business a year or two? What are some basics?
Yeah, good question. Thank you for letting us talk about the fund more, right? Yeah, so we do investments from $250,000 to $500,000. We have a side of the business that does traditional venture investing, typically around the Series A, Series B point. We'll go in with other capital, so look to also be alongside a reputable syndicate of other investors. Round sizes anywhere from 2 to 50 million, typically, of equity infusion. And then we also have a legacy restructure portion of the business as well, where we'll come in and restructure things, typically put in a new option pool and a diverse C-suite to run the new go-forward company. And so we have a portion of the business that's a little bit more mature, that we would do investments out of that side as well. But typically tech-enabled. We also touch on manufacturing, certainly healthcare, and companies just looking to scale and hit that inflection point. But yeah, I mean, we're focused on West Michigan and folks of color, but traditional venture within that.
Oh, this can be that quiet of a crowd.
Anthony, congratulations on all the milestones.
Thank you.
Maybe you can walk us through, and I have a few friends and family members that have died of prostate cancer. And so I'm eager to learn about how you'll commercialize it, maybe the treatment milestones that those patients undergo. And then lastly, what else is on the radar screen beyond prostate cancer?
Yeah, thank you for the questions. So right now, we are going to start from prostate cancer, and because this is the things we spent the past 6 years to do clinical trials, and right now get an FDA approval. Currently, this approval in the United States is only allowed us to treat the patients in end stage and fail on chemo, fail on hormone therapy. Basically, no other treatment is allowed.
Yeah.
And based on the study, the clinical trial we performed, it's 80% better than the best drug we have right now to this worst patient group you can have. But based on our so that's where we're gonna start. Let's start from maybe 10 weeks to 12 weeks from here. And then, but we already know based on our clinical trial in Germany, if we start treating patients way earlier, before they have been bombarded by chemotherapy or hormone therapy, the outcome is way better.
Yeah.
So there's going to be two things we're going to do over here. And that's exactly the reason why we want to partner with the great medical school over here, is we're going to conduct and lead the new clinical trials over here using this infrastructure we have to start explore the collect the data on using this treatment on treating prostate cancer patients in earlier phase. And with this data, and we should be able to gradually expand the application and also allow the insurance company to pay for that. But before that, we are still going to using an explorative method based on the paper published to treat prostate cancer patients and using the dose and the method we think is right. And that's our direction over here. But the prostate cancer is just start. The whole molecular imaging and molecular targeted radiation therapy is actually a concept. That's why we don't want to build a facility just for prostate cancer. We're building a platform allowed us to facilitate the process of a new drug getting into clinic. We already have several drugs partnered with a big pharma company in line to start clinical trials in town for several major cancer like lung cancer, colon cancer, breast cancer, brain cancer, etc., etc. And also these things, the application of these technologies not only limited on cancer, it also can have a significant impact to the neurological and the cardiological related disease. So using molecular imaging, we can catch Alzheimer's disease, Parkinson's disease way earlier, what we can do right now, meaning before the symptom coming out. Also have a great chance to tackle PTSD, depression, CTE, the disease football players have, those what we consider mental health disease. Those are not a mental health disease. That's not a mood problem. There's a brain micro trauma happening in patient's brain, just the current technology cannot see. And this new technology with a high resolution, with a molecular level concentration, we can start detect that in an earlier phase to guide the scientist in MSU to figure out what's the right treatment, what's the potential solution, and we can start tackle that. We are going to see what we don't know, and then using the new knowledge, start tackling things. Another things I really want to mention is we're actually planning and also have a great discussion with Helen DeVos Children's Hospital over here too. Because right now with the most advanced scanner we have over here, this is going to be the very first time we can start applying this technology to pediatric patients. Conventionally, only 1% of these PET scans in the United States is being applied to pediatric patients because we're worried about, number one, the radiation dose may affect the future development of kids. And second, usually we need to scan kids for 40 minutes. So we need to sedate the kids, make sure they're stable on the table. We don't want to do that unless it's necessary. But this scanner is going to arrive on May 9th. It's the very first scanner in the United States, and it's the most advanced in the world. 40 times more sensitive than any other PET scanner on Earth. So we can significantly decrease the radiation dose injected into the patients, but also shorten 40-minute scan time to 1 minute. So with this kind of combination, all of a sudden we open the great applications to pediatric application to use this technology to help the pediatric oncology, neurology, cardiology, and we can guide the doctors what really happened in patients, the kid's body, and we can directly to achieve to do the targeted treatment.
And maybe iterating on that if I can. Some of the synergy happens with, MSU has something called a Facility for Rare Isotopes. It's $800 million funded by the DOE. And so as a result, we have the leading particle physicist program in the country. And so what Anthony is talking about is connected to particle physics, right? So you start to get these connections. And we created a Center for Precision Health. We're helping to develop some of the molecules then that Anthony's group will use to implement. One of the really wonderful things about Anthony's approach to this is he's thinking about not how to generate the biggest profit, but how to make it accessible, right? And so this idea that a 1-minute scan fundamentally changes the economics of a PET scan, right? Which costs about $3,000. But if you can decrease it from 40 minutes to 1 minute, you don't need sedation, you then get to start to use this tool in ways that were prohibited in the past. So another example, right, that Anthony's really passionate about is this idea that you can actually do a PET scan and tell at the time of scan, will a patient with depression respond to medications or to cognitive behavioral therapy, right? Right now, what we do is we say, we'll try this for 6 weeks. If it works, great. If not, we'll try something else. Well, that's 6 weeks of somebody suffering in an extraordinary way when we can get to the treatment faster. So one of the things that we built into this, right, is how do you put things in place quicker to relieve suffering, but do it in an economically sustainable way?
The things we have over here is literally no other else on earth has. When we're doing clinical trial in Germany, when we try to explore some rare isotope, we need to go over the Alps, go to CERN for them to create some isotope, ship that over there to our German clinic to treat. Right now, it's literally 40 minutes away, and it's a way better facility than CERN over there. So what we're doing over here is literally the most unique things on Earth. And we're developing a brand new industry. We're really gonna lead the advance of human medicine.
I saw some other, yes.
This is a kind of related to the subject that was brought up. I really appreciate the focus on like diversity and also acknowledging that diversity is maybe not just racial, but also income. And I've heard, like Boston and San Francisco brought up a lot as like places to emulate in some ways. I'm from Boston, and actually I came to Grand Rapids because Boston was too expensive. And, I just wonder, do you feel like Grand Rapids is safeguarded against issues like housing increase and quality of life is, tilting in wrong directions in places like San Francisco or Boston? Do you feel like Grand Rapids is safeguarded against those, I would consider mistakes or issues that weren't thought of ahead of time?
Yeah, I think that it's a good question. I spent some time in Boston and
Went to school.
yeah, to bring back the winter coats. But yeah, I mean, it's a great question, and hopefully, with cost of living rising, wages are also rising, and so they're typically correlated a little. And so if we're getting some of the increase of prices in housing, hopefully that means we're bringing high quality, high paying jobs, and then it's competition with the housing. And so I think that, as we think about just the benefits that we can see from just more capital coming to the city, I think it will ultimately benefit folks like yourself that are already here, that are already established and, putting down roots here. And hopefully, the jobs that we're bringing in help mitigate some of that. You may get some of that, to be frank, if we're bringing in high-paying jobs, and a lot of them. It's just a fact that housing is scarce in general, and maybe we'll build up more in Grand Rapids. We're getting some really nice high-rise buildings. I know the mayor, that's on top of her agenda, housing is. So hopefully some of that is mitigated some, but also the innovation and just the job opportunities that you would have here hopefully also increase. And so while, you know, inflation and the nominal dollar of things may increase, hopefully the real purchasing power of folks like yourself and folks that are a part of the innovation community will remain the same, if not increase.
And I was in Seattle before I was here and experienced probably very similar things. And I would watch as it seemed like no one was really being planful, right, about how we proceeded. And what I have found here, there's a group now called Grand Action 2. And they're being really thoughtful about as they build facilities or there's an amphitheater being discussed. You know, they have representatives from all the communities say, how do we not make this available only to people that can afford it, but how do we make sure that it becomes a resource for all? So I would say we're being more planful, but when, you know, this idea that when we started focusing on how do we improve health, you know, I think your suggestion, if you're not creating jobs, right, if you're not making education more accessible, if food is not available and affordable, you can do everything you try and everything in healthcare, but you won't affect health, right? So we're really trying to go after the social determinants of health as much as healthcare, and that does mean access to, you know, homes and food and the rest. So I think we're being more planful, and I think that we're well protected from that going off, you know, into, you know, the decade or so ahead. And then hopefully autonomous vehicles and other things will help us make it so that there's ways to move around. But I think that we're in a really good place as a community because we're far more planful than at least the communities I've been in.
That was and Brian, you have to tell me when we have to stop. I know there's a question over here. Yep.
It's interesting the discussions you're having about the community and about applying the research rather than just producing papers, because the Michigan area, a lot of people don't know, has an expanding field in space technology and has a lot of small businesses that have a lot of technological capability. I've been discussing with some of my former professors about trying to bridge some of the gaps that we've seen between the research institutions on one end and the highly technical industry and small businesses on the other end, and finding ways to bring the small businesses that don't have as much research experience, getting them involved in the research and getting that academic side involved in the industrial applications. So I'm curious if you've looked into some of the involving these smaller companies in the research work that you're doing.
Yeah, that's super. I really appreciate that. And this idea that, you know, in a knowledge economy, right? How do you, the key to that is if you can connect your universities, right, to industry, startups, companies, right? That's how you can really be catalytic. And this idea that for startups, they need access maybe to high-end imaging, right? They need access to physicist technology. You can't afford that as a startup, right? But you would bring, right, tech, you bring insights, right, that wouldn't exist about application, right? And it is that bringing together. And that is exactly what we've sought to create here. Like we're working with a group, Twist Think, right? They do human-centered design, right? Bringing them in. The reason we have Spartan Innovations, right, is that it's a way to connect to these startups and help ideas be generated. And you can look at John Kennedy, right, with AutoCam Medical, right? I'm saying that right? Who's been very successful in starting out in the auto industry, but then a lot of cross use, right, of the technology in-house. So really important. If you have ideas on how we can catalyze that more, but it's partnered with Spartan Innovations and Start Garden, right? It's again trying to create that.
You wanted to comment, yeah?
Yeah, I think this is a very important issue. Typically, I think both academic organization and the business entity, they are doing different kind of things. I mean, right now, there's a trend for a lot of academic centers to become more and more like business oriented. And personally, I don't like it. I don't think that's right. And I think there's a reason why academic centers exist, is trying to explore with no purpose. And if there's some discovery can be translated into business opportunity, can really commercialize, impact people's health, people's lives, and then it should be passed to the business entity to actually make things happen. Because this is a totally different kind of skill set. If an academic center only do things which has business coming with which they can commoditize, then I don't think it's healthy for our community for long term. But there is some part over there between the academic center and the business entity. There's an overlap over here. What do we need to do? Think about how to make this resource more accessible to each other, and the talent and the skill set more accessible to each other. I mean, if an entrepreneurship looking for a project to commercialize, what are the projects over there can actually allow them to do that? What kind of support and skill set they can find from academic centers. And also when academic centers have some idea, think this can be commercialized, they can access to that entrepreneur community to really evaluate, have the wake up call to see is this reasonable or not, or how hard it could be. Yeah, I mean, so I think it's right now, I think after 20 years, people jump into this kind of field to explore the idea from academic center to the market, and we learn a lot over here. It's actually the time to really start to clear out the barriers to make the whole system more efficient. And that go back to the living problems in Grand Rapids. I think it's inevitable for Grand Rapids, the house pricing going up, as long as we have a healthy, growing economy. But we have a more successful business, more people moving to Grand Rapids with high-paid job, definitely it's inevitable. But it's not a bad thing. The thing is how fast it grow, and also where it grow into, right? And so Grand Rapids have another advantage I see is we're small and we're new. We're small, so we can move fast, we can respond fast when things go wrong, and also we're new, we can do things right. There's a San Francisco, Seattle, Boston, have a great, I call it bloody, example right in front of us, and we can learn from our example and plan it, and to prevent these things from happening. Make this healthy, house price going up in a healthy rate, to the healthy level, and to booming the whole community right over here. And the same thing we can learn from Stanford, Silicon Valley, Boston about how to translate technology to clinic.
So that goes back to the ecosystem. Yeah. I'm getting the hook over here, so I think we really enjoyed, obviously, these three incredibly talented people who are sharing their talents and their love for this community with us tonight. And I want to thank all of you for coming, and I hope that you got a feeling of what's going on the mile. I drive down here almost every day and have seen it evolve from nothing to what it is today, and I'm amazed of what we've done with the collaborative efforts that we've had. And we didn't touch on philanthropy, but without it, we wouldn't be here today either. This is an immensely philanthropic community that does invest in things that they believe in, and it really does make us different. So I hope you kind of got a feel for what's going on here, and please help me in thanking our panel.